Hi, I'm Dr. Bryce Dogelman with University of Tennessee Health Science Center in Memphis, Tennessee. And this is Dr. Mack Land. We're going to be speaking a little bit about the H1N1 influenza strain. Today is May 1st, 2009. Thanks for being here, Dr. Land. First of all, could you tell us just a little bit about your qualifications?
Yes, I am a professor of medicine at the College of Medicine, Division of Infectious Diseases at the University of Tennessee, and I also practice with UT Medical Group.
And you're an infectious disease specialist?
I am an infectious disease specialist.
Excellent. Well, first of all, could you just give us a general overview? Why is there so much concern about the H1N1 influenza strain?
Well, H1N1 is influenza A, as we have seen many times. The thing is that this is a novel virus in that its genetic material particularly has not been seen in this country before. Therefore, it raises the possibility that we do not have immunity to this virus and that it could spread rather quickly and rather widely in this country, making large numbers of people ill at the same time. Also, a bit of concern has been the number of deaths reported in Mexico, which have not been borne out by the cases that occurred in the United States.
Okay. And what are the symptoms exactly, and who should we investigate for H1N1 if we have that suspicion?
Well, the symptoms of H1N1 are the same as for seasonal flu. Fever, severe muscle aches, headaches, runny nose, cough, and sore throat. With H1N1, there has also been increased amount of vomiting and diarrhea associated, but usually that's been with the other usual flu symptoms. The people that you want to sort of take a history from are the people that you think might have the flu based on your clinical suspicion, and then the people that you want to investigate are people who, number one, have either traveled to an area where there has been endemic influenza H1N1, i.e. Mexico or anywhere in the United States where that has occurred, or who have been in contact with persons who have been diagnosed with H1N1 influenza at this point in time. Healthcare workers who have been taking care of patients who have been diagnosed with either confirmed, probable, or suspected cases. Confirmed cases would be those in which you have a positive PCR or a culture. Probable cases would be you know that they have a influenza A type, but you can't type it, and suspected cases would be those people who've been exposed to ill persons with influenza.
Okay. Now, when we have a patient in any setting, whether it's the clinic or emergency room or hospital, that we suspect of influenza, how should we collect the specimens specifically, and where do we send them? What sort of lab do we need to send them to evaluate the patient for the H1N1 strain specifically?
Well, you want to do two things. One, you want to do a nasopharyngeal swab or either a pharyngeal swab. But you want to collect it with a swab that has a Dacron character to the end of it. You don't particularly want cotton swabs, and you don't want swabs that have wooden handles. You want a plastic handle because that can interfere with the virus recovery. You do the swab inside the nose, and you also need to call the laboratory if you're in the UT system, particularly at the Regional Medical Center at Memphis and at the other hospitals, and get viral transport media. So as soon as you do the swab, you need to insert that swab into this viral transport media, break off the top and put the top on, then hand deliver it to the lab. The laboratory will take that specimen and send it to the state health department, where it will be tested by PCR, polymerase chain reaction, to see if it's influenza A. If it is, they will ship it to CDC, and they will then type it and confirm whether this is H1N1 or some other influenza virus.
So all of the influenza A specimens first go to the state lab, and then they're further suspected of being H1N1, they will go to the CDC for evaluation.
At the current point, that's right. Now, the CDC is supposedly sending the appropriate reagents and material to the state labs so that hopefully by the next week, each state lab can do its own confirmatory test and decrease that. And that's going to take between 24 and 48 hours to get your information back.
Okay. And for healthcare providers who may be seeing patients with suspected cases of influenza, whether that be seasonal influenza or H1N1, what protection do we need to use? And do we need to do anything differently for H1N1 than we would do for seasonal influenza?
Yes, you do. Persons who you suspect or who are in the emergency room waiting room or who are in the clinic waiting room, if they have an upper respiratory tract infection, i.e. coughing, sneezing, and fever, you need to put a mask on them and bring them back and put them in a private room immediately. If persons who have contact with that suspected case after that should indeed wear an N95 fit-tested mask and also wear gloves, and when you collect specimens, you need to have your gowns and gloves on. If you're doing endoscopy, if they have to have a bronchoscopy or bronchial washings, or even just collecting the nasopharyngeal swabs, well, not for nasopharyngeal swabs, but for bronchoscopy, they need to be in airborne precaution room and a negative pressure room to collect those specimens. So you do need to protect yourself. The patient needs to wear a mask anytime they're outside of the room, and you need to somewhat limit visitors to that room and be sure they wear protective apparatus equipment when they're in that room.
Okay. So the healthcare providers should wear the N95 mask, and the patients with suspicious symptoms can wear a regular mask?
Surgical mask.
Okay. Now, can you tell us a little bit about which persons we might consider or offer treatment to, and what is that treatment?
Yes, and the people to whom you would consider offering treatment are people who are known to be or been confirmed to have H1N1 and who are at high risk to have complications of influenza. Persons who have been exposed to suspected cases and who have high risk of complications of influenza. That being persons over 65 years of age, the very young, yes, younger than 5 years of age, those with chronic medical conditions such as heart disease, chronic lung disease, renal failure, sickle cell disease, autoimmune diseases such as lupus, people that have cancer and on chemotherapy, and also pregnant women, because remember, influenza can be quite devastating during pregnancy.
Okay. Was there anything else that you can think of that for the healthcare providers or the general public that you'd like to add, Dr. Land?
No, I think that just using good common sense, washing your hands before you see the patient, after you see the patient, and multiple times in between would be most helpful, and then using the protective device. Remember, this is influenza, and so far we've had, as of May 1 at 11 o'clock, we've had 141 cases, but only 1 death. So this has been regular flu for the vast majority of people in this country. So if you get it, you will be sick for 5 to 7 days, and then you'll get well. If one is ill or has been exposed to somebody who is ill, if you're ill, you shouldn't go to work, shouldn't go to school, and also you need to remain and voluntarily isolate yourself for about 7 days till after the symptoms have resolved.
Very good. Well, thank you, Dr. Land. We'll end our video there. Thank you very much.